All right, so you guys, I'm gonna do the full video, what you all should expect doing checkoffs. This is what you need to watch in order to get the full points that you need for passing checkoffs. So I'm gonna show you, the first thing is how to do a venipuncture the correct way. I'm gonna show you then how to do your IV fluids, how to do your secondary fluids, how to start your IV, and how we're gonna connect the fluids to the patient. Next, I'm gonna show you how to look up the drug of choice that's your IV push that you do have to look up so you know if it's compatible with the fluids that you're hanging. And then after that, we're gonna DC our IV fluids and make it into a saline lock or INT. And if the patient needs more of the medication, I'm gonna show you guys how to give that as well through the INT. So first things first is the venipuncture. So you're gonna have your doctor's orders, which I have. So the doctor wants me to draw a PTT and a bank trough because that's what we're gonna hang for our piggyback. So I have both of my tubes, which is my PTT is my blue and the red top is my trough. I have my cotton balls, my tape, my tourniquet, I have my gloves, my venipuncture set kit, and I have alcohol. So first thing always, you're gonna do your white caps, wash your hands, introduce yourself, explain the procedure, verify your clients, make sure they're comfortable, explain what's going on with them. Most likely if they've been in the hospital for a while, they kind of like know what's going on. So you're gonna go through your entire white caps with us. Once you do that, you get your patient situated in a working condition so you'll be able to work. So this is Mr. Billy. I've already explained everything to Mr. Billy. He already knows, so I'm gonna get his labs first before we start our INT. So I've already washed my hands, I'm gonna put my gloves on. I've already found my site where I want to stick Mr. Billy. So I'm gonna just get all of my stuff together. I'm gonna set that to the side. So now I'm gonna put my tourniquet on Mr. Billy. And you wanna make sure that your tourniquet is not too loose, but you don't want it to be balled up under your client's arm as well. I'm gonna tell Mr. Billy to make a fist, so he's making a fist for me, and I kind of eyeball where I want to stick. I've always told you all that you all will not go up here into these areas at all. When you do your stick, it's gonna be from the AC on down. For testing purpose, we know that we always start with the distal, but I'm doing lab, so I'm gonna get it out his AC. So I'm going to clean my area in a circular motion. You will not fan this area, you're gonna let it dry, and you're also gonna make sure that your client does not fan it or breathe on it or blow on it. If they do, then you need to re-clean the site. I'm gonna get my tape ready while that's drying. All right. I'm inspecting my line to make sure everything is connected. Sometimes you need to make sure that this is completely screwed on because some manufacturers do not screw that on tight. So I'm taking this off and I'm looking to make sure that my bevel is up. So my bevel is up. I'll put this in a working spot. I'm gonna pull the skin taut and I'm gonna tell Mr. Billy it's gonna be a little stick. So I'm gonna stick Mr. Billy. And I have my flashback. Get my trough. And this tube holds about 45 cc's. And when it's done, it's gonna stop giving for you. So it's gonna give all it's gonna give. I'm gonna invert. Now I'm gonna get my PTT. And the whole time I'm watching Mr. Billy to make sure that he's okay. And he is fine. Now I've gotten all I need to get from him. I'm going to pop my tourniquet, apply my cotton ball, and I am going to pull back that the needle retracts back. Invert, place my tape here. Next, this is when I will get my tubings and I will label them, and I will put my name, the time, the date. And most hospitals, they have the printout with the patient information already on it. If not, this is the time that you need to have one of those little small Sharpies so you can write the information on the tube. We're gonna put it in our biohazard bag, and then either I will take it down. If it's something that needs to be stacked, then I will have my chargers or someone else to take the labs down for me. All right, so I got that taken care of. So next thing, I'm going to take these gloves off, and I'm going to get rid of my venipuncture. And I'm going to put that in the sharps container. Okay. All right, next thing I'm going to do, I am going to do my lines. So I have my other pair of gloves. Some nurses will tell you that you don't have to wear gloves. I just like to use gloves just to be safe. If you don't use gloves and you forget to put gloves on when you're bleeding your line, you won't get penalized for it, because some nurses do, some people don't. But I would prefer that you use gloves. All right, so the first thing I told you guys you want to do when you take your tubing out of your package, you want to make sure that you roll your clamp. And the reason why we're rolling the clamp, because we want to make sure when we attach this to our fluid that we do not lose any fluid. So I'm just going to inspect my line to make sure there's nothing wrong with it. I'm going to wrap this up in my hand because I do not want my line touching the ground. Next thing I'm going to do is, in my orders, he wants me to do normal saline at 75 cc's an hour. So I'm going to open this. And I'm going to inspect my bag, and I'm expecting for no cloudiness, any precipitations or anything like that, or anything that's been damaged. And my fluid is fine. And I'm also looking at my expiration date, and it does not expire to 2023 in December. So now I am ready to spike my bag. So I'm pulling straight up, and we're going to insert here. And this is where I'm going to hang this on my IV pole. I'm going to do 3 pumps, 1, 2, 3, and that's just enough so I can make sure that it's draining and dripping. I'm going to unwind this out of my hand so I can have control over it, because once again, you do not want it to hit the ground. And now I'm just going to watch my fluid as it comes down the line. And you want to have good control of this because you do not want to lose any of the patient's medication. Once it's at the end, I'm going to reclose my clamp. Okay. Now I'm just going to hang this right here. I'm going to get my secondary line ready. So I have my secondary line here. I'm going to do the same thing. Once I get it out the package, I am going to roll down the clamp. I'm inspecting my line to make sure there's no damage. And this is my hanger. Because my line has been sitting up here for a while, I am going to clean at my Y site. So I'm going to take this back down. So you want to make sure that you're putting it in the right area. I'm going to wipe this with alcohol. Let that dry. I'm going to connect here. This is when I'm going to get my hanger. Because when you do your secondary, you want to make sure that your primary is below the secondary. I'm going to hang this back up here because I don't want it dangling down. And I'm just going to backflow. And you want just enough in here so when you attach your medication that you see a drop. So now I've already verified that I'm hanging vancomycin. I have vancomycin, and he's getting 1,250 milligrams, and it needs to go over an hour. Same thing with your secondary. You need to inspect your medication. I'm expecting for any punctures, any precipitation, any cloudiness. None of that is there. So now I'm going to attach it. Now, this end here, you cannot stick here. This is for medication purposes, the white end. If other medication need to be added in here, this is the area that the pharmacy will use. So the blue is the part you need to connect this to. So I'm gonna come straight up, going directly in, preventing from touching anything. I'm gonna hang this here. open this up. I'm going to program a pump. So my pump is here. Close the clamp, and this is when I will program. Once I program it, I'm gonna put it on pause because now I have everything set up and now I am ready to start my IV. I've always told you all that you want to start from distal to proximal, so I'm gonna show you how to start it in the hand because that's what textbook says. But based on what's going on with your client, they may prefer that you put it somewhere else. So start cleaning up your stuff as you go, so you won't have a lot of stuff to clean up at the end. So I'm starting to clean up. If my gloves would have gotten soiled, I would have changed another pair, but my gloves didn't become soiled, so I'm going to keep the same pair on because I'm still in the room taking care of the patient. So Mr. Billy has offered me to do it in his hand because he prefers it's in his hand. He said it's just better. So I'm going to roll Mr. Billy's hand over. And as you can see, Mr. Billy's hand, his veins in a curve. You would never start your patient's IV here in the curve. You want it either in the straight. So either we'll stick him here or I will stick him here because these are two straighter parts of the hand. Okay, so this is the time I'm going to get all of my stuff together. So I'm going to do my INT first. And I have my saline that's here. You need at least 2 of saline. I told you all you want to pick up here from the end, never here, because you're going to contaminate. So I picked it up here. I'm screwing on my saline, and this is where you want to bleed the line because you don't want air in your line. So you're just going to put a little bit of saline in there and go ahead and unscrew this top because it can be a little tight. And I'm going to set that to the side. I'm going to go ahead and get my tape ready. So I have my tape here. In your dressing kit, you're going to have another tourniquet. Some have the iodine and some have the ChloraPrep. This is the time you want to make sure you check allergies to make sure they're not allergic to any kind of iodine. But for this purposes, we won't be using it on the mannequin because it will stain it. So we're going to set it to the side. These are your gauze just for extra cleanup, just in case if you have you need to clean your client up. And then this is a Tegaderm dressing, but I will be opting to use this one. So I'm going to set all this to the side. And I have my 20 gauge needle because he's getting vancomycin and it is kind of like an irritant. I want to make sure I have a bigger size needle for him. And just in case if he needs blood, I want to make sure that he has the correct size in as well. So I'm going to go ahead and get that ready. Now I'm going to set that to the side. So I have all of my things ready. So now I'm going to put the tourniquet on Mr. Billy. Now, I am going to do it in the hand. Some nurses will do it even lower. Some will do it higher. I like to do mine higher because I don't like to make constrictions here just in case because I don't want to blow the patient's vein. So I'm going to put it back up here at the top of Mr. Billy's arm. I'm going to make sure that the tourniquet is tight and that it's not pinching the skin. I'm going to tell Mr. Billy to make a fist. So he's making a fist for me, and while he's making a fist, I'm just going to go ahead and move all of my things closer to me so I can have it. So I've eyeballed the vein that I want to use. So I'm going to clean it. We're going to do the same thing, clean in a circular motion. And I'm going to let that dry. Make sure I have this where I can get to it good. All right. Now I'm going to tell Mr. Billy, I'm going to hold his hand and hold it taut and tell him it's going to be a little stick. My bevel is up over my catheter. And I'm going to stick Mr. Billy. And I see flashback in my tubing. So I'm going to thread my needle. Okay. And you want to be flush with the skin. I'm going to hold pressure. I'm going to go ahead and pop this tourniquet here. This is the time that this is a really good one, and he'll probably gonna be bleeding everywhere because my top got stuck. We're gonna screw here. All right. Verify placement. I'm gonna pull back. I got blood return, and I'm gonna flush. And you can flush about 10 cc's, 5 to 10 cc's. So I'm gonna flush about 5. Asking him and watching him the whole time, asking he feeling any stinging or burning. I'm watching to make sure that the site does not swell. So it does not. So I'm going to close off here because I don't want any backflow from my IV. Now I'm going to tape it. And do not tape over the site because we need to be able to see it. So I'm going to place my tape here where I still have visual over my site where I can see it. I'm going to use my dressing, Tucker-Down dressing. I'm going to place it over here. And you want the window where you can see your site. And I'm going to anchor this here on Mr. Billy so it does not move. I'm going to time and date it, which will be here. I'll put my initials and the date and time so the next nurse or the oncoming people will know exactly when this IV was placed. And you all will change your IVI based on your hospital policy. But I taught you all that you would change your IV site every 4 days. All right, so now I am ready to hook him up to his IV medication to start his vancomycin. So I'm going to unscrew here, unscrew here, and I'm going to hook him here. I will put another piece of tape there because I don't want it dangling, because you want everything to be secure. Once I got him taped and secure, I'm going to follow my lines to make sure everything is open. So this is open. I'm going to roll my clamps, and I'm going to start my pump. As I'm watching it, I'm making sure that my secondary is open and it is dripping, so I know that's going. So once this vancomycin is complete, it's going to switch back over to my primary. All right, so Mr. Billy told me that he was in pain earlier, and I told him that we'll get him something as soon as I got his IV started, so I did get it started. So he has on his order where he can get Ativan, and he can get Ativan 2 milligrams every 4 to 6 hours as needed for pain. So I've already done my drug calculations, and yes, you will have to do drug calculation to know how much you need to pull up. So when I did my calculations based on the dose, this is 4 milligrams per meal, so he's going to get a half a meal of Ativan. So this is this. I am going to look up to make sure that it's compatible with the medication that I am giving. So he's getting normal saline, so that's why you have your drug book. So we're going to look up Ativan. Okay, so I've looked up Ativan, and I need to push Ativan over at least 1 to 2 minutes. So this is where your watch is going to come in handy, and yes, it is compatible with normal saline. If it was not, then I would flush with 5 of normal saline, then I will do my 0.5 of Ativan and come back and flush with another 5 of saline to be a buffer in between the medication, the IV fluids that he was getting. So you would need to stop your pump then. Since this is compatible with it, I'm still going to stop the pump. Some nurses don't. They just like to let it free flow in. But so you can have better control over it, I would prefer that you just stop your pump and then give your medication. So that's what we're going to do. So like I said, I've already calculated it up. So he's going to get 0.5 mils. So if he's going to get 0.5 mils, then I need to have at least a 3 cc syringe that says 0.5. So I'm going to pop the top because this is a brand new Ativan. I don't have to swab it because the cap was still on it. I'm going to screw this on. So I have my needle. And I'm going directly in here, just like we did last semester when we pulled up medications. And I'm going to pull down 0.5. So I pull down 0.5. Normally in most hospitals, they have a safety cap on there because you don't want to re-stick, but we got to get this out because we have a needleless system. So we showed you all how to do the swoop. So we're just going to swoop it here. We're going to recap it. This is the only time that you would do this. Unscrew it. I've already paused my pump. So I did not have a green cap on here. So anytime you don't have anything on here to protect this, you need to always keep alcohol in your pocket. So I'm going to swab this to clean it. I'm going to let it dry. I'm going to close this down because I don't want my medications to backflow through the line. I have my saline that's here. I'm going to open. And I'm going to flush with 5. I'm going to pull back first, make sure we still have placement, and I still do have good blood return. Set this over here. And I'm going to flush with 5 slowly, and I'm watching the site to make sure that it does not swell. And no stinging or burning. He said he's fine. Okay, I'm going to unscrew this, put this over in this hand, and then I'm going to attach here. And I'm going to look at my watch, and I'm going to time it. We're going to push this over 2 minutes. And the time that I'm watching him, making sure that he's not having any kind of allergic reaction to the medication, even though he's had it before. If he had not had it before, then I'm really going to stay in the room a little bit extra to watch him to make sure he does not react to the medication. Okay, so we pushed the medication over 2 minutes. Now I'm going to flush the patient again at the same speed that I gave the medication, so there'll be another 2 minutes. And the reason why you're doing that, because you want to make sure that you've cleared the line of the medication. So we're going to push it over another 2 minutes. Okay, our 2 minutes is up. Then I have a green cap because I have some in my pocket. And then I'm going to unhook here from the saline. I'm going to apply my green cap. I'm going to unroll this. And I'm going to restart my medication. Get my patient in a comfortable position and make sure everything is where he needs to be. And I'm going to document where I put my IV, how he tolerated the medication I've given him, everything. All right. So now Mr. Billy has been here in the hospital for 2 days. He's eating now. So the doctor has given me an order to make him an INT. He no longer needs his IV fluids. So I've already came in. I've talked to Mr. Billy. He already knows he's excited to come off of the IV fluid so he can move around freely. So I have my flush that was here. So we're going to flush the line. So I'm going to turn off my pump. I'm going to roll my clamp down. And I'm going to take from here because this was attached to his skin. And I'm going to check placement again on my IV because I'm going to make it an INT. And I want to make sure that it's still working patent even though fluids was going through it. So I'm going to attach this here, pull back. I still have excellent blood return. I'm going to flush. You can flush about 5 to 10 cc's. It depends on how much blood is left in the line, but you do want to clear the line. So we got this line cleared. I'm going to close this off. I have my end cap that I'm going to put on here. And I normally leave my IV fluids in the room just in case if something happened. I still have it. And I'm going to put a green cap on here. All right. So I've INT'd Mr. Billy. Mr. Billy said, Miss Alicia, I'm feeling pain, so I need some more pain medication. So I'm like, okay, so we're going to give him this pain medication again. So you're going to go pull your other Ativan IV. I've already verified it, but this time the doctor said to give him 4 milligrams because on his scan, it showed that he may be hurting more. So like I said, this is 4 milligrams per meal, so he's going to get 4 milliliters this time. So I have my needle. I'm going to draw it up. Let me get that. All right, so I have my needle. This, once again, is always going to be a brand new cap. I pop my cap. All right. Directly in, and I'm going to get his 1 milliliter. Because remember the last time he got a half, so he's going to get 1 milliliter because he's getting 4 milligrams this time. So we're going to pull down to 1. Once again, this doesn't have the safety on it, so you want to do the swoop method. so you won't stick yourself. All right, so I have my saline. I've already checked my line, but we're gonna check it again because anything can happen. Open this up, set my green cap to the side. Got my saline. I'm gonna pull back, good blood return. Then I'm gonna flush. And I've already remembered, because I've given this to before, I can push it over 1 to 2 minutes. So I'm gonna push it over 2 minutes. Unscrew here. I'm gonna attach this here. I have my watch, and we're gonna push it over 2 minutes. Okay, my 2 minutes is up. I'm gonna reflush them again, because remember, we wanna clear the line. And I'm just gonna flush them with the other 5. All right, we'll close him off, and I'm gonna put a green cap on him and get him comfortable, back in a comfortable position. Put all this in the sharps. All right, so now we on day 6. We have got Mr. Billy situated. He is ready to go home. So the things you're gonna need, remember I told you don't DC anything until they're in the wheelchair and they're ready to go. So I have my cotton ball and my tape here, because that's all I need, along with my flush. So I have my flush, because I always want to make sure that we do that. So I have my flush. Mr. Bill is excited, so we're gonna clean here. If a green cap was not on here, I would clean it with alcohol. Open up the clamp, check for placement, and he still had excellent blood return. So I'm just gonna flush Mr. Billy. Close this off, and I'm gonna start lifting here, all the way around. Having good control over my catheter, because I don't want it to come out while I'm trying to remove the dressing. Okay, I have my cotton ball and my tape. I'm gonna place it here, and then I'm gonna come straight out, and I'm looking at my catheter, make sure that it is intact. And my catheter was not intact, that is considered a medical emergency, and I will be contacting the doctor. So Mr. Billy, his IV was intact. I will document my findings, and then I will discharge my patient. And that is all.